Yeah, so the next person who's going to talk is Ewan Harrison. He's going to talk about some of the work that the consortium has done using generating data and using data and linking data up. So yeah, please welcome Ewan.
Hi, thanks. So, oh, it's not changing. Okay, thanks. So I'm going to talk a bit about how over the last 18 months or so, obviously the data that COG generated was not only, you know, the generation of the sequence data, linking it all together with the patient records, with the individual patient, with a specimen ID, was a huge amount of work that went on behind the scenes. And I think really, you know, the success of COG-UK was simply the fact that there was so much work and there were so many things already in place in many cases, and things that were built that enabled us to, you know, succeed. So I want to start really with, if you think about the landscape before COVID-19, and this is just a kind of representation of, you know, in very high level terms. In the UK, we kind of had, you know, we had resources like Climb that existed to people to handle for pathogen data, but in many cases, you know, when genomics data is generated, it stays within a single institution's, you know, computational infrastructure. And sharing of data does happen into international databases. But I think in the ways that COG operated, really, that this didn't happen. There was also, obviously, human genetic data was generated, and that's often linked, you know, quite successfully for genome-wide association studies with you know, clinical record data. But in many cases, clinical record data and pathogen genomes were done on a kind of study-by-study basis. And I think in many ways, you know, COG has really showed how this can be done routinely. And I really hope that one of our lasting legacies will be, you know, particularly within the UK, how pathogen data can be integrated properly with electronic health record data and also the other data that's generated by, you know, other scientists. So obviously, you know, I think completely clear to most people in this room how integral the success of COG was based on, really, on the Climb infrastructure that was already in place. If you talk to people around the world who had other, you know, national sequencing efforts, the fact that we had something that could be stood up incredibly quickly, that in the matter of time that the first genomes were generated, you know, and the fact that then we could integrate that, I think the success of COG has very much been based on the success of Climb, and the team behind that has been really phenomenal all the way through. And I don't think it can be underestimated how lucky we were to have that. So how do things operate in COG? You know, how did we kind of handle data? So I think, you know, as Sharon mentioned in her talk, one of the really most important things that we managed to put together was a data sharing agreement for all 4 nations that allowed us to hold the data in Climb linked with a limited amount of pathogen data. We spent a huge amount of time in a huge number of meetings, kind of not arguing, but discussing about, you know, how much data should go into the public domain, which data should be held in Climb. You know, we wanted, obviously, we started off with a shopping list, you know, pages and pages long. And eventually we got to a position where we narrowed it down. And again, I think, you know, what was the critical success to COG was that we kept things quite simple, actually, you know, particularly our data that went into the public domain. We very, very quickly, with discussions with 4 public health agencies, realized that we were only going to be able to release limited data because of this risk of deductive disclosure, that, you know, where pathogen data can be linked to newspaper articles, etc., and people can start inferring things. So really, the ability that we could share data quickly was down to the fact that we kept it simple. And again, when I've spoken to many international you know, colleagues, they've had huge problems and arguments about data release, and most of it has come down to the discussion around about, you know, what are the risks of deductive disclosure. And I think that by kind of jumping over that and just keeping it quite simple, so just the UK nation, the date of sampling and the sequencing data, has meant from kind of day one, our data has gone out into the public domain. And we've been able to do it really, really quickly, which I think was a recent paper that showed that the UK has consistently been releasing data into the public domain the fastest. And I think that's something that we can all be really incredibly proud of. We also were able to hold more restricted data in Climb. There's been issues behind the scenes about actually putting some of this data in, but we were able to hold further information, as well as a number of fields that were quite more restricted information. And I know huge numbers of the sites physically we're pulling this data off hospital computers and putting it in. And I think that, you know, there's been some incredible efforts behind the scenes to make sure that data was available for people to analyze and use. Although we managed to get this data in, more latterly, we've come to the kind of realization that there are better places to do this, to link to complex patient data. And I'll talk a little bit more about how we've been kind of moving towards that. And I think really where things are going, and one of the legacies of COG will be, is that we can really do this at scale. So what have we actually done in terms of COG data? Well, you know, from day one, before we could even get the data into GISAID and into the European Nucleotide Archive, it went up onto the website where it still goes up today. And I think that this is, you know, this has been something that I've been in many conversations with people about, you know, how did COG do it, etc. And the answer was simply, we just put it on the website. We just did it. And I think that was really a phenomenal thing that's meant our data has been globally available. Also, as well, obviously, it's flown into GISAID, and there's a huge amount of kind of computational infrastructure based in Clyde and at the Sanger Institute that, you know, takes all the information about the individual sequences, the people who generated it behind the scenes, and make sure that the correct acknowledgement is there and it goes into the public domain. As well, of course, now it goes into the European Nucleotide Archive as well, where the data is genuinely publicly available. Where else did our data go? Well, you know, it flowed throughout government, and to this day, you know, it still continues to. The COG data has been an integral part of the UK's response to COVID-19. For example, you know, the data was made available to SPI-M, the modelling groups. The linkage with the COSIN data allowed very, very early estimations of the severity of the alpha variant. Again, the kind of linkage process behind the scenes, ensuring that the individual samples are linked to a patient. There's been a huge amount of work, particularly within the public health agencies, in ensuring that happens, and that continues to this day. It's still not perfect, but I think there's obviously been a lot of lessons learned about how in the future we should be operating with data. Obviously, again, the COG data is part of the variant technical reports, and also, you know, now it's starting to flow into other places. And I'll talk a little bit about the work that's been going on behind the scenes to ensure that we can link data more widely. So one of the things that we realized, obviously the data was held in Clyde, and one of the key things is that the COG IDs go into the public domain. So that's the sequencing ID. And this means that the COG IDs can only be held by the public health agencies and the people who generate the original, to hold that linkage between the specimen and an individual. Because if that's broken in any way, then the whole system of the way that the data is held anonymously in Clyde breaks down. So to overcome this, how do we link the data? So to link the data elsewhere where it's now happening, so the COG data is flowing into Sale in Wales. It's also going into the ONS trusted research environment. What has to happen is we have to replace those COG IDs, and this all goes on behind the scenes in the public health agencies, where the COG ID is then replaced with a unique specimen ID that in most cases is anonymous, so it can then be held in the trusted research environment. And there's been a huge amount of work that's been going on, really, particularly in the last year, to ensure that this can happen and that COG data can be linked externally. So one really good example of this is we've been working very, very closely with the genomic study. So this is the study of host susceptibility that's identified a number of novel variants in the human genome that are associated with the severity of COVID-19 disease. And in our original submission for funding, we said that one of the things we wanted to do was to ensure that virus and host sequences will be linked. So we've been doing this, and there's been a huge amount of work going on behind the scenes. In the last few months, we've been calling up labs where samples are still been stored from earlier on in the pandemic and getting those samples out of freezers and sequencing them. And we're at the point now where we've nearly got 10,000 linked virus and host genomes. And I think this is a really unique data set. I think, you know, probably globally, we're in a situation where we're going to be able to look at the association between the potentially human genetic variants and viral mutations. To do this genome-wide, we're going to need a lot more samples. So maybe in time we'll have to do this as an international collaboration. But I think that this really shows, you know, where the potential in the future is for, you know, linking pathogen data up with other kinds of data. And I think it's been a huge a huge piece of work that really is hopefully is the start of things to come in the future for pathogen genomics. So kind of where are we going next? Where's COG data going? So it's been decided that there's obviously this linkage between the viral sequencing ID, as I mentioned, can't be broken. So COG data can't go to too many places. So it's basically been decided that in the case of the English and the Scottish data, the whole sequencing data will go to the into Edinburgh, into the EDRIS or EPCC, where it's the UK national supercomputers held. And this is starting to come together with work that's been led by Kenny Bailey and Health Data Research UK, who've been really integral in this, with the idea of an outbreak data and analytics platform. So this is that you'll have viral sequencing data, host genomics data, clinical record data from the ISRIC, and all of the different sources. You bring all this data together in one place. The advantage of this system is you have a trusted research environment where you can interact with really complex data, so you can extract complex information about comorbidities. You can turn that into a score, a summary score, and then transfer this across to a place where the viral genomics data is held, and then you can do your kind of complex analyses. And I think that there really is the potential for this in the future is obviously really great. Look, shortly, once the Scottish data is there already, we're just going through a governance process about the English data. Once that's there with a new governance process that will oversee this, COG researchers will be able to access this data where, basically you'll be able to link to really detailed electronic health record data, as well as the viral sequences. So on one hand, we've got CLIME, which is superb for the genomic epidemiology work. And now the COG data is starting to flow into places where if you want to link up the clinical outcomes and severity data, we can also do that. So I think, again, this has been a real benefit of the work that COG-UK has done. And again, it's taken a huge amount of work behind the scenes, particularly the support from Health Data Research UK, to get us into this position. So I just want to finish really with a kind of a slide, and I think this is, in my mind, certainly is where things are going now, and I hope that this is going to be one of the lasting legacies from the unfortunate situation of the COVID-19 pandemic. But the work that COG-UK has done is, how do we think about taking pathogen data in the future and ensuring it's linked up properly? How do we ensure that a sample, from a particular patient, if it's interest, that's captured, it's sequenced, you can link that with immunological data, you can link that with a human genome. And I think that the kind of the work that we've been doing to get that data into the trusted research environments is really a starting point. And I think that, with the development of suitable LIMS software, we really could be in a position where one of the outcomes is that we can really revolutionize how we do kind of big data infectious disease research. So with that, I'd just like to thank, there's a list of names here. I've undoubtedly missed so many people. There's been so many people who've been involved in this. It's been a real kind of handle turning exercise, huge amounts of kind of quite slow and painful calls around data information governance and ensuring that changes to metadata, etc. And I apologize for sometimes that been a bit of a slow process, but I think ultimately we've been incredibly successful. And I think that the future really for the legacy of our work is going to be that data really just get linked up properly, and we think about kind of pathogen genomics in a slightly different way. So, and obviously there's the mandatory COG slide, and thank you for listening.
Ewan, thank you very much.